Welcome to Realizing Global Health. My name is Dr. Elvira Beracochea. I'm the President, CEO, and founder of Realizing Global Health. We are a global health consulting company where we work with clients to help them develop self-reliant, sustainable health systems that deliver quality health care to everyone, everywhere, every day. And today, the topic that we're going to talk about today is the fifth key number 5, to sustainable global health programs. And we talked about focusing what we do on the health system. Then we talked about understanding how health programs work and how they make the health system work. We talked about services and facilities. We talked about health providers. Today we're going to talk about the important function of governance. Governance is at the head of the health system, and that needs to work clearly. And unless there's ownership in the country, they can take the leadership in how all the activities that develop the health system work. It's very difficult to sustain the achievements that we've had in global health. That's why I really want you to think, what are the governance functions that we need in my country to make sure that we are really doing work that is going to be lasting, it's going to be effective, and is really going to contribute to the development of the health system, to really ensure that we provide healthcare, quality healthcare, to everyone, everywhere, every day. And there are 10 functions that are important for any governance program in a health system. First, you have policy and planning. These two, I'm going to talk to them in pairs so it's easy to remember them. Policy and planning. Policy says what has to be done and how. Planning makes sure that it happens. So that's how every year we have annual plans, and we have also usually 5 or 10-year health plans that says how things are going to happen, how we're going to progressively implementing these policies to really make sure that we enforce them, we fulfill them. Next is the ability to monitor and evaluate. We need to monitor how health activities are being implemented on a regular basis, preferably in real time, and there are many tools to do that. And then we need to evaluate. So monitoring tells us, are we doing things the way we said we were going to do them, and are we really getting the results that we want? And then in an evaluation, we look at whether the objectives that we set were accomplished, and were those objectives really the ones we wanted to achieve. Sometimes objectives change, priorities change, and then it's not that we're doing wrong work or our work is bad, it's that we are not addressing other priorities, other objectives that we need. So we always need to evaluate our objectives to make sure they're really still important. So we talked about policy and planning, monitoring and evaluation. Then we're going to talk about financing. Ministry of Health and Ministry of Finance need to work together with donors and other organizations that contribute, the Global Fund, the World Bank. There's so many organizations that contribute to the national health budget. Now we need to make sure that this is done in coordination. The next thing is the health surveillance system. If there is an outbreak of Ebola, you want to know. If the incidence of malaria is increasing, you want to know. You need to have weekly morbidity and mortality reports that tell you how well the health system is working. And everybody needs to have access to this information. And then you need to look at regulation and accreditation. How does the health system regulate whether this place can't really provide health care or not? They have to be accredited. You need to make sure that there are regulations on food hygiene and in sanitation. All those things need to be in place, and that's what the governance function does. Also, we need to look at partnerships and coordination. We need to make sure that the donors are coordinated. So you need to have structures to do that, and you need to make sure that you are managing the partnerships not only with donors but also with other organizations in the private sector, the business sector, the NGO. So these are very important functions that we have to make sure that are really working. And so they are policy and planning, monitoring and evaluation, financing and health surveillance, regulation accreditation, donor coordination, and partnerships. If you have those 10, then you can have a great global health governance program that is going to really keep improving the health system to really deliver quality health care to everyone, everywhere, every day. See you next time. In the meantime, you can contact us by email or find us on Facebook or Twitter or LinkedIn, and we'll be happy to know more about your work and see if we can help you. Until then, see you next time. Keep working and moving forward to realize global health. Bye-bye.